Yes.
You want to sign up something?
Yes. What's up before? Yeah.
Nabokore tuga ya tu anyora ngaba kare abantu babwatiruga gusa abandi kafyu batari kobororo abandi bakonywa marwa n'ibintu bunebyo ngabana mtu abato gatie bara sabe bwana
ndio karibu na yeye mtoto na yeye
kai mzone
nani si mimi nataka na hii covid
Lucky that we have our governor to just read the
We also don't want our businessmen to be part of our candidates, isn't it? We need to agree. Let us follow the guideline we have been given very clearly by the ministry on how you are supposed to operate as a hotel, and also, in particular, those who are who have restaurant. We have realized people have started changing their lifestyle, changing the way of operation, and I just want to give the chiefs a clear directive on the issue, and particularly on the issue of the barrios. The barrios are very clear regardless of our customs. We agreed we cannot have more than 15 people. So that one should be very clear to our team. and because they are the people who usually issue the burial permit, those ones we must ensure we have followed the guidelines from the ministry. The other issue I also want to mention is together with the county and the national government, we are also in a journey also to ensure our elders who are working with our chiefs will also be providing them with the masks, which we have continued receiving from different suppliers. There are those people who are assisting us. We have also received from Nairobi, and we are also expecting more. We will continue going up to the village level because these are the teams that are assisting us, and that reminds us of the support that we have been getting from our elders, the Kisii community, anybody who travels from outside. We have our surveillance team that is monitoring, and we are ensuring if there is anybody who has arrived, and particularly for the areas that have been declared by our minister as a hotspot, we want to know. We have been using the Murika number, that is 988. The minute you flash an issue concerning a person who has arrived, either from Nairobi, from Mombasa, also from Kisii, which is also a new area that has also been identified, we are able to make a follow-up with the surveillance team that is headed by our able Dr. Ongwae.
We have sent very many samples. We have sent we have had a total of 305 people who have a travel history, and their samples have been taken and they have all come up back as negative. This is going to be a holding center for those people that are breaking the curfew, the people that are not following the guidelines of COVID. Because what has happened is that when we get those people, they are actually taken to our quarantine center. You know where the quarantine center is? The quarantine center is at KMTC with close to 100 beds. And you do know that our isolation center is at the Kisii Teaching and Referral Hospital, which is fully equipped with all the necessary machines. We have screened close to 400,000 people that are getting into Kisii County. Of course, the initial screening using the thermogun does not give you the complete picture, but it gives you a certain level of comfort so the people who are coming in may not be sick. I would want to urge my brothers and sisters who live in Kisii County that as a county government we are doing all our best to ensure that we are able to take care of our people, the people that are living with us in this county. And we are working very, very closely with national government, with the county commissioner, you can see me here. I would want to indicate that as a county government, we have also taken a supplementary budget since there is no county that knew that there was going to be COVID-19 in order to have resources available for that. But our supplementary budget as we speak is with the county assembly, and we hope that once it's passed, then we'll be able to have the necessary emergency funds that we need to move the process forward in ensuring that we have everything. But for the time being, based on the budget that we had, we have been able to continue ensuring that we are not, that we are up to date in the whole area of health management. What we've done here is we've made sure that we do not mix the facilities that were for students. So we agreed with the principal that we bring in our new things. You've seen the bed looks like a double-decker, but we are using the upper part to help us in to ensure that the whole area of malaria control is easy. Otherwise, we would have broken the ceilings up there to start putting malaria nets there. So the upper part is actually helping us in the context of making sure that that's where we're putting the malaria nets.